Member for Saanich North and the Islands.
Thank you, Mr. Speaker. Today is a good day for youth on the Saanich Peninsula. I've spoken in this House about a pilot project spearheaded by a local doctor in Sydney to provide a health service specifically for youth. Recognizing there was no supportive health clinic for youth on the Saanich Peninsula, Dr. Kate Evans started down the path of creating it. After many meetings with stakeholders and support from the South Island Division of Family Practice, a pilot project for a clinic aimed at youth from 12 to 24 was born. Clearly, there was a need in my riding for an inclusive clinic close to home, open after school, and judgment-free. The clinic was only open for 2 hours once a week, and doctors would see between 4 and 16 patients each week. The 2-month pilot stayed open for 6 months. They closed in mid-December of 2017 to examine the project and apply lessons that they learned. It was not just physical issues. Youth were seeking mental health support for anxiety, depression, substance abuse, psychotic symptoms, grief, and complicated family issues. The doctors built trust with their young patients who felt they had someone who they could speak to about any mental health issue that they were facing. My partner has faced mental health challenges since her youth, and perhaps the early intervention a clinic like this offers would have helped her address the trauma she has experienced much earlier in her life. Fast forward to today, literally today. I'm delighted to say that they're opening again. This afternoon, they opened in their new space in the Peninsula Medical Clinic in Sydney. Supported by a number of local organizations, including the Town of Sidney and the Saanich Peninsula Primary Health Care Society, and with significant funding from the Ministry of Children and Family Development. This is yet another example of government financially supporting the incredible efforts of community members. I raise my hands to MCFD and the leadership of those involved in this important project.